So today I am trying something new, so bear with me. Usually I have the quizzes up and available for you to use, but this time I am going to use information directly from test.com. Now keep in mind the information for test.com is input into the quiz as well, so the visual is different. So I know that some people like the bland content, which is okay because it offers less distraction. It mimics exactly, almost exactly to the format of the test as far as just the black and whiteness, So what I want to do is just see if this is better for you, if you like this much better than the colorful purple quiz. So let's give it a roll and see how it goes. So this is the NCE practice exam from treatment planning from test.com. As you can tell, from the top. And so let's go ahead and get into it. It's 39 questions in total, and we're going to get through all of those today. All right. So blank are a part of treatment plan the counselor and client need to visit at various intervals to determine success. Is it A, supports, B, methods, C, outcome, D, sessions? Outcomes. Looking at outcomes will help the counselor and the client determine if there has been success in meeting the client's goal. Depending on outcomes, the client goals may need to be revised. Supports are another part of the treatment plan where counselors help clients develop a list of positive supports. Methods are techniques used to achieve goals. You are working with a 12-year-old girl and are concerned she is being physically abused. Which of the following is correct? A, you do not ever need written consent to communicate with state personnel. B, you should attempt to get all legal guardians to sign release forms at the start of counseling services in case you need to make a report to Child Protective Services. C, you do not need the legal guardian's consent to share this information with Child Protective Services personnel. And D, once you have reported the concerns to Child Protective Services, you should notify the minor's legal guardians about your actions. So C, when a counselor is concerned about any type of abuse or neglect, as a mandated reporter, he or she is legally required to report these concerns to Child Protective Services. A is incorrect because there are many careers in which people work from the state and will have no right to confidential information. D is incorrect because once a report is made, the reporting individual's identity can stay confidential. If a client who has social anxiety is in the blank stage of Prokaska's and diclimatase, their transactional or transtherical mode of changes, it will be important to talk about complying with the client's treatment plan as he may be making plans to change, but not yet making any changes. We would say A, pre-contemplation, B, contemplation, C, preparation, and D, action. So we're gonna go with C. When a client is in the preparation stage, he would be thinking about and making plans to change some of his behavior, but does not yet have to commit to these changes. It would be important to lay the groundwork for complying with the treatment plan goals during this stage. Before the client has to make changes, in the pre-contemplation stage, the client is not aware that the change is needed. In the contemplation stage, some clients beginning to take part in planned changed activities. You let a client know they may feel temporarily worse as they enter into the blank phase of the therapeutic progress. A, exploration. D, will B, identification. C, resolution. D, orientation. The exploration phase can be painful for clients as they are identifying or recalling negative, hurtful experiences. So we are going to go with A, exploration. By the end of this phase, a client has learned to reframe their thoughts and expectations and will feel stronger. Getting a follow-up appointment after discharge from a mental health hospitalization is blank for the long-term wellness of the client. A, unnecessary. B, essential. C, recommended if covered by insurance. And D, statistically significant. We're going to go with essential. If clients have a follow-up appointment within 7 days of discharge, studies show they are more likely to use ongoing services and stick with their prescriptions. C is incorrect because follow-up appointments are recommended regardless of insurance. D is incorrect because statistically significant is a term used in statistical hypotheses testing. Sarah is a 60-year-old client working on a goal of increasing her physical fitness to improve her overall health. When reviewing her treatment plan, it will be important to revise if A, Sarah completed 2 of the 5 objectives, B, Sarah has not completed any of the objectives, C, Sarah was on vacation and didn't work on the goal during that time period, and D, Sarah is excited to get back to better health. You're going to go with B. If Sarah has not completed any of the objectives, the counselor and Sarah need to revise the treatment plan so Sarah has achievable objectives. A is not correct because Sarah still has 3 objects that she has to meet. C is not correct because her vacation is a extenuating circumstance. For which of the following situations would a counselor refer a client to another professional for concurrent treatment? A, when a client's needs are outside of the counselor's knowledge base. B, when a client with a mood disorder decides they would try to take or try medications to help their moods. C, when a counselor is unable to work with a client. D, when a client could benefit from working with a counselor who uses a different approach. We're going to go with B. Since counselors are not typically able to prescribe medications for clients, referring the client to a psychiatrist would be necessary. The client will see both the counselor and the psychiatrist for concurrent treatment. Answers A and C are reasons a counselor may refer a client to another counselor. Which of the following is a primary indicator that your client needs more than outpatient and or group counseling? A, diagnoses of depression. B, self-injurious behavior. C, diagnosis of narcissistic personality disorder. And D, dual diagnoses. D, dual diagnoses. If you are seeing a client for a mood disorder and then discover they also have a substance abuse disorder, they could benefit from detox and treatment in a residential facility, followed by outpatient counseling. Answers A and B, as well as C, are all appropriate for outpatient counseling. Self-injury is different from suicidal ideation attempts, and clients often benefit from CBT counseling to learn more appropriate coping skills. A client has a goal to make short and simple to-do lists with 3 tasks to complete each day. This is a short-term goal for a client who is most likely to be diagnosed with A, gender dysphoria, B, intellectual disability, C, schizophrenia, and D, depression. Clients with depression often have lost interest in activities and have significant impairment in their daily lives. By helping your clients create a to-do list, it could help them start taking initiative and building positive habits. All clients may benefit from a to-do list, but most likely their different goal will be consistent with their diagnoses. For example, if a client was diagnosed with gender dysphoria, a short-term goal may be to talk with someone who has transitioned. A short-term goal for a person with an intellectual disability experiencing loneliness could be connected with a social group of peers. And an appropriate short-term goal for someone diagnosed with schizophrenia could be to read more about their disorder to acquire more self-awareness. Michael is a 22-year-old client working on a goal of increasing client-defined good days over an 8-week period. When reviewing his treatment plan after several weeks, it would be important to revise if Michael found a new online resource which is helping him keep track of good days. B, Michael is practicing relaxation techniques more than what is noted in the plan. C, Michael's definition of good days is making it difficult for him to have one because he's equated good with perfect. D, Michael has a minor argument with his brother who is listed as a support. You're going to go with C. It would be important for the counselor to help Michael change his definition of good days into one that is more realistic. A is incorrect because a treatment plan does not have to have an exhaustive list of tools a client finds helpful. B is incorrect because no revisions are needed since Michael is practicing relaxation techniques for at least the minimum of number of days as noted in the plan. D is incorrect because Michael's brother could still be a support even if they have a minor argument. A client you have been seeing for several months brings her husband for a session at your request. You felt that educating the husband about your patient's depression would be helpful, as well as eliciting his support in her recovery. At the end of the joint session, your client's husband asks if he can keep coming to the sessions to work on their marriage. Your best response will be, Mr. Smith, I think it's a fabulous idea, but let me ask Mrs. Smith. Mrs. Smith? Mrs. Smith, I was hoping you would say that. You two have such potential, and I'd like to help you enhance your relationship. C. Mrs. Smith, I'm sorry, but under no circumstances can I see you for marriage counseling. It is a conflict of interest. D. Mr. Smith, I appreciate your willingness, but I'd like to further discuss this with Ms. Smith since we have been working independently up to this point. You're going to choose D. The ACA Code of Ethics states that when a counselor changes a role from their original or most recent contract relationship, he or she obtains informed consent from the client and explains the right of the client to refuse the services related to the change. In answer B, the counselor is making a decision for the client. Answer C is not true. Counselors can shift roles if informed consent decisions with the best interest of the client is in mind. Answer A puts pressure on Mrs. Smith without her considering all the potential consequences of the counselor shifting the role. When looking at the strengths to help clients attain their goals, having the client understand their own blank factors is important. A, risk. B, relevance. C, resilience. And D, reserve. Resilient factors protect the individual against negative effects of daily stressors, which is an important part of goal attainment. Resilient factors can be developed and include traits like self-compassion, grit, mindfulness, optimism, among others. It would be important for a counselor to help a client examine their risk factors, those personal characteristics that increase a person's vulnerability to daily stress. Also, but they are not considered strengths, so the answer is incorrect. Lisa is a professional counselor working in a private practice. Lisa is currently credentialed to accept state insurance from clients. When Lisa submits her request to bill the insurance company, she must submit a blank along with a diagnosis in order to compensate for counseling services. A, global assessment of functioning. B, ICD codes. C, goals of counseling. And D, treatment planning. We're going to go with D, treatment planning. A professional counselor must submit documentation to the insurance company that outlines the plan of treatment for the client. A treatment plan is written approach to counseling treatment that has been discussed, identified, and agreed upon between the client and the counselor. The treatment plan should include the clients presenting problems, their goals for therapy, the therapeutic methods or interventions used, time estimate, and the length of number of sessions that are predicted to be needed. Once a treatment plan is developed, it is not written in stone and can be adapted according to the progress or lack of progress of the client, or if the goals of the client happen to change. When would it most be valuable to talk to a client about complying with treatment planning or the treatment plan? During the session. B, when the client is starting a new prescription medication to treat depression. C, when the client misses an appointment. And D, counselors are not qualified to talk with clients about compliance. B, when a client is starting a new prescription and medication to treat depression. When clients start new medication to treat a mental illness, many stop taking it before it had enough time to work because they do not see immediate results. By educating the client about the treatment plan, they will be more likely to comply with their medication compliance. A is incorrect because the first session should focus on building a rapport and getting to know the client. Also, the treatment plan may not even be established yet. C is incorrect because missing one appointment is a sure thing to happen from time to time. If a client goes on to miss several appointments, talking to them about complying with the treatment plan will be appropriate. D is incorrect because it is imperative for counselors to educate clients about the value of complying with the treatment plan. Which of the following is true about follow-up care? A, future hospitalizations are likely to increase with follow-up care. B, a client should wait until symptoms reappear before scheduling a follow-up appointment. C, clients who do not seek follow-up care are at a higher risk for homelessness. And D, follow-up appointments are only needed for clients who were hospitalized because they were suicidal. We're going to go with C. Clients who do not receive follow-up care are at greater risk of negative outcomes, including homelessness, substance abuse, violence, and suicide. B is incorrect because a client who has a follow-up within 7 days of discharge is more likely to keep meeting their treatment goals. D is incorrect because if a client has a mental health issue serious enough to require hospitalization, they also need follow-up care. A is incorrect because follow-up care can help clients continue to set goals to improve their mental health, which will likely decrease future hospitalizations. When talking with a client who is in recovery from addiction, you flag the minefield to mark potential future setbacks. What is the most common reason for addicts to relapse? A, stress. B, social group. C, overconfidence. And D, unrealistic expectations. Stress, number one, in response to why people who are in recovery relapse. So we're going to go with A, stress. Stress is the most common reason addicts relapse and is interconnected with hunger, anger, loneliness, tiredness, also known as HALT. Answers B, C, and D are also barriers for clients suffering from addiction, but are not the number one cause of relapse. Which of the following is a main concept in reality therapy? A, responsibility. B, punishment. C, the past. And D, formal assessment. A, responsibility. The first goal of reality therapy is to help the client become psychologically strong and rational. A strong and rational person is the one that is autonomous and behaves responsibly towards self and others. Reality therapy focuses on the present, eliminates punishment and does not include formal assessment. You have been seeing a client named Mary for several months. During this session, she mentions that she had been in touch with her old counselor that she had been seeing over a year. And in fact, she had gone to see him. She states that he wanted to see her and her father for a session. You should. A, tell Murray that she should stop seeing the other counselor and confound her treatment plan. B, tell Murray she should stop seeing you and see her other counselor instead since they had long-term relationships and knew her better. C, tell her that seeing two counselors can have a compounding effect on her benefit. D, acquire a release authorization of information to contact the other counselor to discuss further. It's going to be D, acquire a release for authorization of information to contact the other counselor to discuss further. The ACA Code of Ethics states, when counselors learn that their clients are in a professional relationship with another mental health profession or professional, they will request a release for the clients to inform the other professionals and strive to establish a positive and collaborative professional relationship. The counsel should determine their option or opinion of what is best for the client, communicate this to the client, and allow the client to make a decision about her care. A client has goal. A client has a goal to increase and practice the ability to manage anger. This is an appropriate long-term goal for a client who is most likely to be diagnosed with A, adjustment disorder, B, obsessive compulsive disorder, C, conduct disorder, and D, autism spectrum disorder. We're going to go with conduct disorder. When clients are diagnosed with conduct disorder, they often are irritable and have aggressive or destructive behavior, which will make a goal focused on anger management very appropriate. Clients diagnosed with any mental disorder may experience stress, which can lead them to have feelings of anger, but primarily the goal of anger management would not always be needed for the other mental health disorders mentioned above. Which of the following is the best example of responsibility of an office-based counselor that may be listed in the treatment plan for a client with a goal to use more positive parenting strategies? A, the counselor will call the client's family members to interview them about his parenting style. B, the counselor will be on call for the client. C, the counselor will observe the client in his home using learned recently positive parenting strategies. D, the counselor will provide the client with materials to document the new house rules, rewards, and consequences system. It's going to be D. Providing the client with materials to document new rules, rewards, and consequences will be an appropriate responsibility of the counselor. Answer A is incorrect because that could be confidentiality issue. Answer B is incorrect because that could violate a necessary boundary between the client and the counselor. Answer C is incorrect because office-based counselors do not typically go to clients' homes. In which phase of the therapeutic process would the counselor let a client know he or she may test a client's boundaries? A, orientation. B, exploration. C, resolution. And D, identification. Identification. During the identification stage or phase, the counselor and client are figuring out what the client wants to work on. At times, client may still have their guard up, and the counselor will help them lower their guard by gently testing their boundaries. In the orientation stage, the client and counselor are building rapport. During the exploration phase, the clients look inward and learn to reframe positive experience. They will eventually begin to have a healthy mindset. Suzanne parents have decided that she will enroll in state college near their hometown. Suzanne did not apply to any other colleges, and when her mother informed her that she will be an undeclared major for the first year, Suzanne nodded in agreement. According to James Marcia, Suzanne is experiencing A, identity diffusion, B, identity foreclosure, C, identity moratorium, and D, identity achievement. Identity foreclosure. Maria's identity statuses are based on the presence or absence of exploration or crisis or commitment in adolescent's decision-making. In identity diffusion, there is no exploration and no commitment. In identity foreclosure, there is commitment, but no exploration, and the adolescent often follows another person's strong commitment to a choice. In identity moratorium, there is active exploration, but no commitment. In identity achievement, there is an exploration of choice and a commitment after exploration. Suzanne is following the commitment of her parents without considering other options. A 13-year-old client with school avoidance is working on a goal of reducing days absent at school by 20% over a 2-week period. When it's time to review his progress, the counselor asks him to share his attendance log, and he shares his progress or lack of progress towards his goal. He and his counselor decide to revise the goal to be more achievable. Which of the following would be the best revision? A, the client will gradually be re-exposed to the school setting. B, the client will reduce the days absent at school by 30% over a 3-week period. C, the client will increase days present at school by 40% over a 4-week period. And D, the client will be homeschooled. We're going to go with A. Since the client is continuing to avoid school, it would be best to work with school to come up with a plan for him to gradually start attending some parts of the school day. The client could have input into which parts of the school day he would be willing to attend. Answers B and C are incorrect because they are just as out of reach as the initial goal. And answer D is incorrect because without taking into and talking to the family, this may not even be a plausible option. Your client receives a bill for services and becomes incensed. Your office staff tells you that she came in irate and yells to tell you and your office staff to up the bill. She is going to blow this place up. Which of the following applies? A, you cannot terminate the services as it will be considered abandonment. B, you can terminate treatment. C, you can terminate treatment after you call the police and have a session with your client to discuss it. D, you cannot terminate treatment unless your client actually makes an attempt to harm you. She was probably just angry. B, you could definitely terminate treatment. The ACA Code of Ethics notes that a counselor may terminate treatment when in jeopardy of harm by a client or by someone with whom a client is in a relationship with. When a client set blank goals, they are more likely to attain them. A, single, measurable, achievable, realistic, and time sensitive. B, specific, measurable, achievable, realistic, and time sensitive. C, specific, maintain, achievable, realistic, and time sensitive. D, specific, measurable, achievable, response oriented, and time sensitive. You're gonna go with B. When goals are SMART, there's a less chance of a barrier, which will prevent clients from reaching goals. When setting goals, counselors can help the clients identify the following 5 components: specific, what do you want? Measurable, how will you know when you have reached your goal? A, achievable, is it within your power to reach the goal? And R, can you realistically achieve your goal? T, time sensitive, when exactly do you want to accomplish your goal? A client of yours is considering shifting careers. Being a doctor has always been a strong interest of hers. She has always had good grades, but wants to be sure she has what it takes to get through med school. Which of the following should you suggest that she take? A, an interest inventory. A B, the MBTI. C, the 16 PF. And D, the aptitude test. The aptitude test. Your client has already determined her interest, so an interest inventory is unnecessary. The MBTI and the 16 PF, while potentially helpful, assess personality traits. The aptitude test will address your client's concerns around her potential to succeed. You are meeting with a 7-year-old boy who has a school phobia. The school psychologist from his public school called to coordinate care and see if there's anything that you've worked on that could apply to help the student while at school. She will be completing the full psychoeducational evaluation and ask you for your oral and written feedback. In this case, you should A, release all information because it is a representative from a public school, which is funded by the state. B, check to make sure his legal guardians have signed a release from allow you to talk to this individual to give the oral and written communication. C, let the school psychologist know that this is an unethical request. D, ask the parent if they would like you to release the information, then speak with the school representative. I'm gonna go with C. Check to make sure his legal guardians have signed a release form allowing you to both release and receive oral and written communication with the school entity. When communicating with other professionals, it is important to make sure the minor's legal guardian has given written consent for you to share information about the minor. The release form should specify types of communication and information you may share. A is incorrect because confidentiality still applies with school personnel. D is incorrect because the best practice would be to have written consent. Okay, so we have made it to question number 27. I really, truly hope you like this different way of presenting these questions. Let me know in the comments what you think. If you want to see more of this, if you don't care for it, let me know because this channel is for you. All right, hope you have a great day, and I will talk to you soon.